Let's start about the algorithm of diarrhea. As we know that the diarrhea is change in frequency or consistency of the stool. If the diarrhea is less than 2 weeks, it is called acute diarrhea. And if it is more than 4 weeks, then it is called chronic diarrhea. Now we will go toward the causes of diarrhea. There are actually the two causes of diarrhea, inflammatory diarrhea and non-inflammatory diarrhea. In inflammatory diarrhea, these are the mentioned causes. If suppose a patient eat a hamburger and he came to the hospital with the diarrhea, then it is mostly E. coli, and we will avoid antibiotic use in this case, as it will lead to hemolytic uremic syndrome. Suppose a patient uh, is infected by the Campylobacter jejuni and he came with the diarrhea, he will give the history of poultry. Same is in case of non-inflammatory diarrhea. And suppose a person eat reheated rice and came with the history of diarrhea, then it is a case of Bacillus cereus. Now coming to these are the causes of inflammatory and non-inflammatory diarrhea. Now coming toward the main algorithm of how we will treat the diarrhea. These are the some red flags, which is a bloody diarrhea, abdominal pain, temperature greater than 38 degrees centigrade, dehydration, immunocompromised state, age greater than 70. If these symptoms are absent in a patient, then we will simply treat him with symptomatic treatment like fluid therapy and antidiarrheal drug, loperamide. If these red flag signs symptoms are present in a patient, then we will take further history to ask him about the antibiotic use or a hospital admission. If the patient used clindamycin, amoxicillin, or second or third generation of cephalosporin, then it is the case of Clostridium difficile. We will use him. We will use metronidazole, redoxamycin, or vancomycin. If the patient do not use any antibiotics or recent hospital admission, then we will investigate the cause, which is the fecal stool culture and stool ova and parasite and fecal RBC and WBC test. In these cases, we will use the empirical treatment like ciprofloxacin and metronidazole.